Good morning, my people. Welcome back to my YouTube channel, and it's my hope you are fine from where you are watching this video from. Personally, I'm fine, as you can see, and Mombasa is fine too. We are still discussing one of the most important topics, which is kidney failure. It has been one of the longest topics we have ever discussed. And today we will see or look at Serumcretinine tests as one of the tests that can be performed to ascertain if your kidneys are working in the right way. Remember, days ago we started looking about kidney function tests, or tests which can be carried out to determine a well-functioning kidney and a failing kidney. And before we continue, if you are there and you are watching this channel for the first time, please take a second or two, subscribe, and don't forget to put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you. And for the returning subscribers, I always appreciate you guys, because this channel is where it is because of your support. So let's continue encouraging our brothers and sisters so that our channel can grow bigger and bigger. Serumcretinine tests. Serumcretinine tests. As we observed before, creatinine is one of the products that are always eliminated by the kidneys. So what will happen when you have a failing kidney? Definitely it goes without saying, serum will be found there. So in serumcretinine tests, the blood tests, it's always a blood test, examines whether creatinine is building up in your blood. Definitely if the kidneys have failed, and we said kidneys are the filtering system, is the filtering system of your body's blood, or filters the body's blood to remove the toxic wastes like urea and creatinine. So if the kidneys are failing, definitely creatinine will build up in your systems. So the blood test examines whether creatinine buildup, whether there is creatinine buildup in your blood. The kidneys usually completely filter creatinine from blood, as we have said before. So kidneys usually filter creatinine from blood completely. So a high level of creatinine suggests a kidney problem. When the creatinine levels are high in your bloodstream, it suggests that the kidney function has been compromised, or the kidneys are not working normally. That's why the creatinine has not been filtered and it's building up in your bloodstream. According to the National Kidney Foundation, or NKF, a creatinine level of higher than 1.2 milligrams per deciliter for a woman and 1.4 milligrams per deciliter for men is a sign of kidney problem. Let me repeat this point, which is very important, that according to the National Kidney Foundation, or NKF, a creatinine level higher than 1.2 milligrams per deciliter for women and higher than 1.4 milligrams per deciliter for men is a sign of kidney problem. I hope we are together up to that point. Another test that can be done is what we call BUN, or blood urea nitrogen. Blood urea nitrogen. Blood urea nitrogen, or BUN tests, also checks for waste products in blood. Remember, urea and creatinine, all of them are eliminated by the kidneys. So when the kidneys are failing, or when the kidneys are not working normally, definitely there will be buildup of urea and creatinine in your bloodstream, and which are very dangerous to your body systems. So blood urea nitrogen, or BUN test, also checks for waste products in blood. Urea nitrogen is a breakdown product of protein. So urea nitrogen is a product of breakdown of proteins. And the kidneys should be in a position to eliminate this urea nitrogen completely from the blood, because urea is one of the dangerous byproducts of protein we have in our systems. So if the kidneys are failing, definitely there will be a buildup of urea nitrogen in your blood. A point to note, and this is very important: not all elevated blood urea nitrogen tests are due to kidney damage. This means there are other causes which can make, or they can lead to a buildup of urea nitrogen in the system. So not all elevated blood urea nitrogen tests are due to kidney damage. That means you can find a buildup of urea nitrogen and the kidneys are normal. Common medications, including large doses of aspirin and some types of antibiotics, can increase blood urea nitrogen. That's why we are saying, if you find elevated levels of blood urea nitrogen, it doesn't necessarily mean that you have kidney damage. Some antibiotics and aspirin, when given on high doses or overdosed, can lead to an increase in blood urea nitrogen. I hope that point has been gotten correctly. So, common medications, including large doses of aspirin and some types of antibiotics, can increase blood urea nitrogen, and I've already explained that. It's important to tell your doctor about any medications or supplements that you take regularly. Most people, when they visit the health centers or their healthcare workers, not everybody can open up and tell the doctor that I'm using this and this supplement, or I'm on this and this drug for this reason. So it's always important to be open to your healthcare provider or your doctor and explain whether you are using a certain supplement, so that the doctor can balance maybe the medication he or she is giving you to avoid this increase in blood urea nitrogen, because urea is very dangerous to the systems. So it's important to tell your doctor about any medications or supplements that you take regularly. Even if you are taking a Piriton, make sure that you inform your doctor. You may need to stop certain drugs. If you open up to your doctor, he or she may decide to stop some or certain drugs. You may need to stop certain drugs for a few days before the test. So before the test, the doctor can advise you, stop these supplements you are taking, stop these medications you are taking, so that the test can be carried out. A point to note, which is very important: A normal blood urea nitrogen level is between 7 and 20 milligrams per deciliter. So if the test is carried out and your levels are in between 7 and 20 milligrams per deciliter, that is very normal and it can't harm your body systems. A higher value could suggest several different health problems. A higher value of blood urea nitrogen could suggest several different health problems. Another test that can be carried out is what we call estimated GFR or estimated glumerular filtrate rate. This test estimates how well your kidneys are filtering waste. That's why it's called estimated glumerular filtrate rate. Yani, it estimates the rate at which your kidneys are filtering the blood or are filtering out the waste. So this estimates how well your kidneys are filtering waste. The test determines the rate by looking at factors such as the following. Estimated GFR or estimated glomerular filtrate rate test determines the rate by looking at factors such as number 1, test results specifically creatinine. You can see whether there is a buildup of creatinine. Number 2, age. Number 3, gender. Number 4, race. Number 5, height. Number 6, weight. Glomerular filtrate rate test determines the rate by looking at factors such as test results specifically creatinine, age, gender, race, height, weight. A point to note: any results lower than 60 milliliters per minute. Any results lower than 60 milliliters per minute may be a warning sign of kidney disease. Any results. The key word here is any results lower than 60 milliliters per minute. This means that the rate at which the kidneys are filtering the blood is so low. So this may indicate that there is a compromise or the kidneys are compromised. They are not working normally. That's why we are saying any results lower than 60 millimeters per minute may be a warning sign of kidney disease. This marks the end of our first video today. Thank you for your time. Thank you for each and everyone who is doing anything, whatever little it is, to support this channel, be it by subscribing, liking, sharing. Feel appreciated. Let's meet in our next video tomorrow.